It's my great pleasure to introduce Dr. Jan Scarlett. Dr. Scarlett is a professor of epidemiology at Cornell University. She is the director of Maddie's shelter medicine program there. Dr. Scarlett was the first person who had a shelter medicine course. She's a real pioneer. She started that 10 years ago. Her current interest of research and teaching focuses on the prevention and control of diseases in animal shelter. So, Dr. Jan Scarlett.
So I've been asked to talk about this myth that life-saving strategies lead to warehousing of animals, which leads to unhealthy animals. And I thought we would just start and look at what Daniel Webster would say about what is a warehouse. Well, I think this is a nice modern warehouse. It's a storehouse for goods or merchandise. And Daniel would go on to say that it's a place where we set aside or accumulate things as for future use, or to confine or house in conditions suggestive of a warehouse. And I think that all of us could agree that looking at a warehouse, this is not a facility that is conducive for keeping dogs and cats. And that none of us really want to think about warehousing animals. There is a definition here about confining mentally ill people to large institutions for long-term care. That's why so many of those institutions no longer exist, because they weren't humane places. And so we want to strive not to warehouse animals.